All right. Welcome back or not. This is slow and steady win the race. This is not the best part of the day where and of all the places that you could have been, you're here. So thank you. Hopefully we'll finish as soon as possible. It's 4 o'clock. It's on Friday. We all have been probably knackered. So yeah, I will try to slow the tempo if I can, so that I will not speak a lot of information that it won't make any sense. Before we went on break, we were talking about evidence-based practice. We said evidence-based practice is you as a clinician using your clinical expertise to apply the best available evidence to your patient, taking into account their preferences. We say there are processes of evidence-based practice. One is ask the clinical question, the relevant clinical questions. I would say these questions can come with a patient asking you about things that you don't know, or it can be that you have a reflection of your practice. You want to find what are the evidence out there. There are frameworks to structure those questions. Its use is good. You don't have to use it, but it's good for you to use the frameworks because they give you a good structure to when you go to the internet, and the internet, I mean the databases to search, you will have relevant articles that will be used to inform your decision. That's if you're a clinician. If you are into research, I think it's important you use it because the importance of using a process in research generally, it allows repeatability of the process. So you are expected to use the PICO or the SPICE or the SPIDER if you are doing a secondary research, particularly if you are doing a systematic review. It's technically a must for it to be well considered because you are outlining the processes you followed and whoever is coming behind you will do. So the first is ask the clinical question. The second bit is we said once you ask the question, then what? It is finding those information, acquire. And the best place is, we said there are healthcare related databases where librarians have indexed those articles and you can find them in there. So acquire, we give a lot of examples, Pedro. And once you acquire those articles, we talked about appraising those articles. For you to appraise those articles, this is the slide I'm showing an example of the appraisal we've considered. And there are different things to consider. However, there is what we call appraisal tools. It's a workshop on its own, but just to introduce, we have an appraisal tools. And there are a lot of examples, and I've put a link in the chat function box. You can go ahead and develop your knowledge around that if you are already not an expert, because I know some people have already used it as well. So apart from those three my next question is, what is the next A? Because there are a lot of A's for those that are joining us. What is the next A?
Applicability.
Ian, okay, thank you. Applicability. When you say applicability, what do you mean by applicability?
To check if the study is, rather the intervention is fit for your own patient. looking at
Okay.
the population, looking at the condition, the availability of the, well, sorry, not availability actually. I mean you being able to actually apply that intervention itself.
Okay. I like the last word. Okay. So it's more or less you being able to apply that itself. Okay. That's you being able to apply that itself. So the next A is apply. Apply. Just to let you know, uh, I, I guess it's internet. All those that have been requesting since in the morning to join as much as possible, trying to connect them. I know people have mentioned about having difficulties, so just keep trying. Maybe it's not the best part of the day. I should have mentioned this early, but um, if once you log in, I've already approved it. It's just that sometimes it takes a time based on your internet to get connected also. Yeah. But I know the NSP Gombe have been doing well in terms of guiding people. My people, yeah. So the next bit is apply. So this is where you combine the evidence. So we said we are looking, you find the literature evidence. Okay. You have it in your hand. You look at it, you appraise it, and you are happy with it. Now is where you applied it with your clinical expertise in physiotherapy as well as Mrs. B's experience. She enjoys group exercise, for example, and wants to stay independent. You look at group exercise interventions, and as much as possible, you can give us self-management programs because she wants to be or sort of to encourage her to carry on. She seems to be very positive and is somebody who can follow instructions. And you look at the available resources, you can also refer her to the community if that's what the evidence is, which is what the evidence is. And based on the available evidence, we've not gone to in detail, but if we look at the research articles, if you look at the NICE guidelines, what it recommends is a tailored intervention for this particular patient. For those that remembered in the morning, those who have had two falls or more within the last 2 4, they are already automatically at high risk. And it is recommended, apart from the assessment, we plan a tailored exercise program focusing on balance, strength, and function. And it's something that you probably want to do also for Mr. B, Mrs. B. And once you've done that, then the A is you assess. This is where outcome measures comes into play. You assess. So you look at the evidence. Sometimes it can be after 8 weeks, after 12 weeks. It depends on your judgment. So you assess the outcome of the intervention, whether it's working for your patient. Because while it is expected it will work, but sometimes despite the best evidence, those things might not work for all patients. So it might be an opportunity to review whether it's working or not. And if it's not, then you change the course of action. And it's expectedly, now every clinic have different outcome measures that they use popularly. If you don't have any, I will recommend after today, you find very simple, straightforward, cost-effective outcome measure. It doesn't cost you anything, some of those outcome measures to start using in your clinic. Back balance, talk, there are two brilliant examples. You can use it. So you can look at outcome measures, for example, the talk or the back balance, and see whether the patient has improved on it. And you can get some views or experiences of the patient and her willingness. You assess whether she's willing to continue and the feedback. And if it works, why not? And this is where you get your experience. This is why as clinicians, when we first graduate as virgins, bright, and we don't have experience, some of the things we do might be different from the times when we have experience. Because when you apply an intervention in the patient, it's not only the patient getting better, it's you also. You improved your own ability or your own reasoning or understandings on how to treat your next patient. And if it worked for this patient, why not? If you see other patients with similar condition, it's straightforward toolbox in your toolbox. You can apply it for the next patient who are at risk of falls. Just a caveat, we know evidence changes, evidence keep updating. So the fact that you have found something that worked 2, 3 years ago, 5, 10 years ago, or whatever years ago, another 5 years down the line, that doesn't mean you cannot go back again to find for evidence in the guidelines in the literature, because it might be something has come up and then you want to update yourself and make sure you are doing best for your patient. And that is the cycle. And then it repeats all over again in terms of evidence-based practice. Okay, how you can use research to inform your practice. We begin by finding the relevant question. You acquire the evidence, you appraise it, you applied it, and you assess it. Okay. Let me see if you guys are still with me. Looking at my image or diagram, how do I call it? Is anything missing on that image on the one I'm sharing on my screen?
If I'm not mistaken, like appropriateness, cool?
Patient.
Not, yes, Francisca, you said?
I said patient preference.
On the okay. Is okay. Anything else? Maybe not patient preference. So it's within the A's. Is anything missing?
The 5 is, the 5 is
Sorry?
where place of preference is appropriateness.
I need my answer. Or is anything missing on the screen? It's not appropriateness. Patient preference is one of the key pillars alongside the evidence and clinical preference, but we're talking about the process. Take me out of my misery. Just encourage me so that I will know that yes, 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 Esther. Assess. Assess is missing. So there is no assess in it. You assess the outcome of whatever you've applied. The one I've just spoken lastly. You assess. Thank you. Okay. I know it's not the best time, but I want to really want you to try these things and see if you can make sense of it. Okay. I plan for group activity, but I don't think I will do that considering how internet plays out. So group activity, the plan is to split you guys. We are how many now? And I know people join at the later stage. We are almost above 50 or so. So if I split you into groups, I know people have difficulty getting in and out. So it might not work well. And it's that part of the day that it's difficult. So we're going to do it as a class. In the morning, I asked, well, earlier today, I asked you to, so the first A is to ask clinical question. I think one person or so have put in the first A in the clinical question. I hope you have probably also trying to start to think of those questions in your own clinic settings. I will leave my screen like this. What I want you to do is Once you've come up with your question structured in PICO format, why don't you try quick search? Use the Cochrane library or Pedro skill. So all you need to do, the one I showed, go to the Google, use the Cochrane library or Cochrane search. We will skip the appraisal bit because we've not done it, and try to find any articles, any article that talks about something relevant to your own practice. And you don't have to even follow this process. I just want you to find out any article that is relevant to your process, any article on the internet. You don't have to download it. If you find it, can you put the link in the chat box? Just find any research. It doesn't have to be article, ever nice guidelines or research evidence, any evidence that is related or recommendations by the professional bodies, be it MRTB, NSP, Federal Government of Nigeria, or World Health Organization, anything that relates to your own practice. I want you to look for it on the internet. Anything. You don't have to. If you can use the PICO, use the PICO. If you can't use the PICO or Spider, just do a normal search in the internet and find any evidence relating to your current place of practice, and put it for me in the chat box. So any articles, try to find any articles that you think is relevant to your practice and put it for me in the chat box. You don't have to download it. You can put the links, but if you can able to download it, that's fine. Okay. While you are looking at that article, I will add a bit of layer to it. Can you scan the article? You don't have to read the whole of the article. Just scan through the abstract. Just scan through the abstract. Just scan through the abstract and look at look at the intervention or whatever it is outcome in particular area of investigation they are interested. If it's intervention, is straightforward, what intervention they used. If it's not intervention, what is that area of interest? Are they looking at experience of patient, economic evaluation, whatever it is they are interested in? So, and then the second thing is, how do we, if it's intervention, what is the outcome they use to assess the outcome of it on patient? So any article. So I'll give you probably from now 7-ish more minutes from now to 4:25. 7-ish more minutes. If we need time, I probably will increase it to 4:30, but let's see. I don't want us to sit in silence and then people probably find it difficult to work on. Please, if you have difficulty, let me know. Just find any article. While people, any article, I'm going to, whilst people are looking, I'm going to share my own screen and show you the two things I'm referring to. Two things that there is somebody, Deborah Desmond, has been trying to join since, and I've been adding the person. Just let the person knows that I think it's the internet. The person I've been trying to join since. So let's have a quick look, and hopefully this time out you can see my screen. Okay. So there are two ways I want you to do for me. All you need to do is, the first way is just forget everything. Oops. just type in whatever it is. Let's say stroke rehabilitation. So you want to find information about stroke rehabilitation. So maybe normal Google search is not the best. You can just look at Google Scholar. I will encourage you to use rather than normal Google, but you can do normal Google as well. So you can either do Google Scholar, or let's do normal Google. Stroke rehabilitation. So all these things are not articles. So I guess that's why the normal Google Scholar. So effectiveness, let's check it. But when we go to normal Google Scholar, it gives us nice, quick way of finding articles. Let's put physiotherapy. Okay, so brilliant. There are lots of them. Stroke rehabilitation, and that's the normal Google Scholar search. I think we have an advanced option. Google Scholar have an advanced search. For those that don't know, you can use the same advanced search with all the words stroke. Sizes. Or maybe let's say dual taxing. So just by searching, you can see, maybe I will take the first one. You can see dual taxing effect on motor cognitive abilities in individual with stroke. And all you need to do is you can click in here and copy it and send it to me, or you send it on the chat box, or you can download it. Okay. And what I want you to read is abstract. All I want you to read is the abstract. One is a systematic review. And we are looking at the interventions. So the interventions, most of the times you can find it in the method section. So they are talking about dual task training in patients. So that's what they are talking. What sort of outcome do they measure? No, this one doesn't necessarily apply, but because it's a review, there is no outcome. So dual taxing induce more improvement in single working function. Mobile ability, did they mention, talk about cognitive function? Yeah. And then, yeah, so there's no need to go into the article in detail. That's the example of doing the search. Oh yeah, so these are the articles and whatever it is they've done. And if I want to apply it in my clinic setting, for example, all I need to do is I will read the article in full, but I will need to look at whether it's going to be any sort of important. Does my patient have cognitive problems? Whether I can apply it to my patient. I will go into the article and read it in detail. I will stop sharing my screen. So I hope people have, let's see, so resuming from where I stand. Okay, let's have a quick look. If there is anything on my chat box, people have come up with, oh yes, so thank you, Suleiman. Yep. OA ultrasound exercise pain. Okay, so that's example. Yep, brilliant. So I will probably stop here. You can actually continue. Like I said, I'm mindful of the internet. I won't split us into groups. This is just an overview, a tester. and we can continue to look at the articles in detail, to review it, to appraise it, and see how you can apply it in your practice. But beyond the literature review, sometimes we can develop new interventions. You can, apart from the information you will find online, sometimes you can develop new intervention or specific ways to implement intervention. So there are two things. You can decide that there is no appropriate interventions that work for you, and you go ahead to come up with appropriate intervention, or you can decide that, oh, this is a beautiful, nice guidelines. However, implementation might be a problem. So you need to look at how you can implement it within your local context. And there are different ways of doing it. They have different unique designs. One of the designs I'll probably mention today is a co-design approach or co-production principles. Co-design approach, it's relatively sort of new in healthcare, but it has been around for a while. Now, this is a collaborative process where the end users, so think of your patient. So the intervention is not about, oh, you, the physiotherapist, the power, whatever it is about actively involving the patient, the end users, in shaping the solution. So what are the problems that you will find in your clinic in implementing XYZ intervention? Working with your patient, hearing their point of view on how you can apply that intervention, that beautiful piece of intervention, in your clinical practice. How you can apply that beautiful piece of information in your clinical practice. Sorry, I think I'm just going to mute. Yep. So co-design principles, where the solutions are shaped by those who will use them. There is a popular saying, you have to involve us. Basically, for them to take ownership, you have to involve the people that you are doing the activity for them, basically. The importance is it increases the relevance and greater ownership and enhanced sustainability. So relevance, the solutions that will be found, the best evidence, may be difficulty in implementing it. So the solutions that you will find, it will be a real world solution that grounded in their problems. That will be addressed. And more likely, they are more likely to adapt, to take ownership, because it's their voices that shape that idea and sustain the intervention or help they will create. Earlier on, we talked about false prevention groups. I think I posed the challenge for somebody in the group, and the person accepted, of creating a group activity-based false stuff. We talked that community-based activity or physical activity or promoting exercise is good. Well, it's difficult for people to do it. We have a lot of women development association, faith-based organization where people gather. So you can take this co-production approach where you sit down with them. There is a process, you can find more information, but the whole idea is you don't just go and give them a sheet of paper and tell them 150 minutes exercise a day. Off you go. I want you to be doing this. You can sit down with them and see how they can improve on their activity in their group or society. For example, we talked about those that are coming to have a meeting for 2-hour session, they can dedicate 15 minutes at the start of the meeting, and just to do, even if it is marching on the spot and clapping or singing and going around, just to build themselves, while to add a bit of flavor. But sit down and discuss with them what will be like if they want to implement this in their settings. So instead of designing the false prevention program in isolation in your clinic, or just printing a sheet of paper, giving it out, dishing it out, our client, our patient, they are active users. They are the reason why we are practicing. We are still in trade of business, so we have to value and take their opinion. And based on the research we talked about, quantitative evidence alone doesn't covers everything. Qualitative views, patient experience. So a physiotherapist might work with the older adults or their family or their community leaders to what we call co-create exercises. You can have a list of otago exercises. We talked about otago exercises. Brilliant exercises, but believe you me, it's not enough to just print that sheet of exercises and just hand it over to your patient. You can sit down and find how can you implement that otago exercises in their settings. The educational programs that we are talking about, earlier on, some people talked that, oh, there is a gap in knowledge. That is why there is lack of awareness. It's not enough for you to just go and sit down in the radio station and be speaking and expect that it will have an impact. Oh, of course it will, because there are evidence of radio jingles and conversation or educational materials. But the question is, for your particular local community or patient, is there something that you are missing, or is there something that you could have considered in coming up with your approach? The best way to do that is co-creating those ideas with the people that will benefit from them. It doesn't mean that they are the same people that you will administer the intervention, but what it means is that it is similar. If you create it among people that have fall in JAWS, for example, you can apply it among people that have falls in similar setting to that of JAWS in that same area, in the same terrain anywhere. So it's just looking at those contexts that will help them, and they will advise you on the delivery method. Oh, I don't have time. What's the best time? When can we do it? All those things. And there are a lot of them. Participatory action research. If you look at the clinic, you will look at, if you look at the literatures, you will look at things like participatory action research, where communities are involved and identifying the problems. You look at, there are topics about implementation science. A lot of different ideas are out there. My message is, after today, I think you should sit down as a clinician. It's not, and all of us are doing a great piece of work, but can you go a little bit further? Rather than garbage in, garbage out, go back, sit down, either engage with the literature, plan a process or whatever. It doesn't cost anything. Some of them, not all of them. Go and meet your client. It doesn't cost anything. Example, we talked about make every contact count. These are all quick interventions that you can apply to your settings. My next slide says, in your view, what are the challenges and solutions of falls prevention in your community? What are the challenges and solutions of falls prevention in your community? And if you live here today, okay, what will you want to find out? Want to find out more? If you live here today and want to find out more, so you want to go and figure out, maybe I want to go and find out more about how we'll go about finding out, how will you find out more about the service gaps, the problem in my community? I've been trying this in my clinic. I've been trying this. It doesn't work. How will you go out about and find out the information, the service gaps and needs? There are different bits. Apart from the research evidence we talked about, the local context, you can employ different sort of research. If it is finding more information, the qualitative approach is best. You can do your surveys, focus group interviews, informal structure, or you can do a co-creation workshop where you sit down with people just to get their views in things that you could add to your practice. There are a couple of examples that I will share. A recent study this year that was done, the physiotherapy for older people program. basically for improving mobility in people receiving aged care. Okay, it's more or less an implementation randomized control trial. What they look at in the study is they look at older adult, although theirs is in a community center, so it might not be truly affected in some of our settings, because I know how much we are lacking in that community aspect of care facilities. So those older adults in the care home, so they look at tailoring a strength and balance exercise for those people to reduce their fall in that settings. The innovation, they call it the top-up intervention, which is a co-designed. They use a co-design. So by co-design means they sit down with those participants and figure out how they will do it. It includes a virtual assessment, which may not be applicable in our settings because internet might be a barrier, but in developed countries, for them, probably is a luxury that they can afford. So they use virtual assessment, tailored exercise videos. So maybe one of the things they found out is the sheet of paper doesn't necessarily work. They need an instruction of how to go about it. And then support from care workers, from aged care workers to support the participant. What is the result? There is improved mobility among those population. There is reduced risk of falls as well as pain. And you will imagine this will improve the quality of life in the older adults in both the community as well as the residential home or facility where they find themselves. Now, I guess what is telling us now is that telephysiotherapy or physiotherapy using the internet, whatever it is visible and scalable where the in-person services is limited. And these sort of local services can be expanded to reach out for people. But this is something in a different context. Ours, maybe internet might be different, or maybe not. In other the Southwest, particularly Lagos, where you have, or Abuja, where you have a high internet access. But using the co-design interventions or approach ensures that the intervention is relevant. It's not just one piece of research that will just be done so that you will, having partially completed a degree and then you tick box and then you keep it in the shelf and then you continue your bits and it doesn't matter the impact. Is accepted and is sustainable going forward. Another example exists, but this time around, they looked at traditional approaches versus of falls prevention, and based on the risks and emerging technologies. I can share those two articles at the end of today. They categorize them, the patients, in different risk level, and I think which we looked at. The low risk category, where you look focused on health promotion and community-based exercise. Generally suitable based on the categorization for those who are generally well and active. The intermediate risks, which is the summary of it, using tailored exercise program and nice modification for people who are mobile and environmental or who have some mobility or some environmental challenges, mobility issues or some environmental challenges, and high risk of individuals, which we talk about multifactorial assessment and multidisciplinary intervention. So they tailored the interventions, medications review, all those things. And they add a bit of public campaign. They find that the public campaign makes a difference. Example, make every contact count that I mentioned earlier. The innovation that is considered is the leverage on technology and personalization for impact and access. So they provided digital exercise program for the participants, interventions via telehealth, and they give example, the top-up program that we looked at earlier in the article. This also is a study that was done recent this year. So patient doesn't have to worry about coming to the clinic. Once they have internet access, they will be reviewed and access and everything. They provide balanced, simulation-based balance training for the patients, as well as support for the caregivers. It can be, so whatever the level of false risk an individual is, all we need to consider is tailoring the interventions across around the patient needs, their preference, and our clinical judgment. And there are a couple of ones also, a couple of studies, but I guess in Nigeria, it's more of the patterns or the prevalence of those interventions. But the studies that were conducted in more older adults, it's mainly around the same thing we started talking about the loss of balance account for 30% of the causes of falls, environmental hazard followed by the next, and the location at which the falls happened. Now, this gives us an understanding of where we should target our interventions and what we should be looking at. So understanding this, it gives us as clinicians how we can design our target interventions. And they mention about community education to raise behavioral risks awareness and advocacy or policy change. And this is where the NSP comes in, or the MRTB, in terms of advocacy and policy change. And this is the summary of the intervention, community-based intervention from the studies. They look at modifications. I will also use the example, NEPA took light, so lightening is important. Earlier on, one of the participants mentioning about lack of light causes the fall among one of our clients. Exercise prescription. We said that exercise prescription, balance and strengthening are good. But also is the question of, is it group exercise or face-to-face? Is up to us. Health education, raising the awareness, and collaboration with the community leaders to make sure it's effective. I will pause here because I think we almost coming to that particular end of the day. Is there any question? Okay. No? All right. So yeah, we're not done yet. Just a bit. Just give me a few minutes of your time. We're not done yet. Most of this research or whatever we'll do, if it's a research and it's considered a full research, we have to consider ethics and ethical processes. I know there are lots of experienced people. Can I leverage on your expertise? For those that have done a research, can you share with us your thinking process before I now wrap up? What are the processes you use to apply it for those research? What are those processes? So for those that anybody wants to share with us, all of us have done one research or the other. If we can't remember, just ethics application. What is it like the process? If you can remember the one you've done. So the first question is, what is it like the process, the one you've done? The second one is the what is the use of applying ethics? Because I remembered in my undergraduate, believing you me, is a tick box exercises to fulfill all righteousness. I don't know. I just do it just to get it done. So two things: what are the process and what is the relevance of it? So what are the process and what is the relevance of it? Anybody wants to graciously share with us their expertise? Any research process you are aware of, what is the process and what is the relevance of it? So like I said, I know people are talking about people that have applied have, I try to as much as possible approve, please. I know it's difficult, but if you have problem, you can log out and try to log in again. So what are the process and what is the relevance of it? Any volunteers? Thank you. I think there are some ideas coming on board. Okay. Thank you, my HOD. Welcome on board. So a written proposal. Yeah. So the process, there should be a written proposal. Yeah. Thank you. Yep. There should be a written proposal. Absolutely. What is the relevance of it? If anybody can remember the sort of things they've done before. Okay. Yeah, so just to crack on, so I have on my slides, I think one is from one of the institutions here. The letter here is one of the institutions in Nigeria. The other side is the process that we use in my own university ethical approach or processes. And rightfully so, the head of department, FTH Gombe, kindly acknowledged the need for the mentioned the written proposal. It's common practice, and I think I remember we have to write sort of a proposal before the data collection, bulky documents, and from the ethics application here, from I believe it talks about written proposal, spiral binding, 16 copies, and submitting it, all those processes. But and that's my experience before. In terms of us, it's usually there is a template. The template covers key information, but they are looking at the background mainly and the methodology and all those confidentiality, and then some checklists to show that the research is safe. The main thing that they are looking out for in ethical research is one, they are looking for respect. Now, we know sometimes we tend to get buried in the technicalities of it, but it's put in place to protect the patient. It's put in place to protect the patient. So core principles of ethical research or ethics that we're looking at is respect for the person, or merely we are dealing with person or animal or whatever it is. The person must be treated with dignity. So when we go to, you have to demonstrate how you will be able to treat the person with dignity, the processes you will follow, and informed consent is essential, whereby the person kindly agreed or that they will participate in that research process. But it's not only about consent, it's about informed consent. Informed consent whereby they know what they are signing for. So ethics or ethical research and ethics panel, expectedly, they should look at participant information form whereby you should explicitly, clearly communicate why you want to do the research, the benefit or harm, and so that the person, whoever is participating in your research, can make a decision, informed decision based on the knowledge you've given onto them, whether to participate or not. And they can be able to withdraw if they so wish, because it's voluntary participation at any point, okay, wherever is possible. So that's one. Respect for the patient, one, both in terms of treating them with dignity, but secondly, in terms of them agreeing to be part of the research, giving an informed consent. The second thing is beneficence. All research with all intent and purpose should be to do good and avoid harm to the patient. And it has to be clear in how your research is meant to do good and avoid harm to the patient. Risks should be minimized and potential benefits maximized. So within the research, it needs to minimize and potential benefits to maximize. And that is why in research processes, sometimes it might not be justifiable to deny treatment for people who are ill or need a treatment on the basis that you want to do your research and compare them with others without a treatment also. The third leg of the ethics or principles of research is the fairness of it, justice. So the justice of it. Participants, I know there are different recruitment processes, participant recruitment, but there should be some fair selection of participants. And of course, apart from the manipulation that you do in the research process, if required, no group should bear more risks or unfairly treated compared to the other. No group should be excluded from benefits, unfairly be excluded from benefits. It's unethical for that to be conducted. No group should be excluded from benefit. Unfairly excluded. So 3 things that research should look into in terms of the core principles, apart from the other methodology and things that we're looking at. The respect for the participants that you will be recruiting, the beneficiaries, trying to do good, that's what it means, minimizing the risks, maximizing the benefits, the justice, the fair selection of the participants, and not unfairly excluded. Different organizations, I believe, have different processes and different institutions as well. But what I have here is just a quick snapshot of what is obtainable one in a UK high institution, and the other one is what is obtainable one in Nigerian high institution. Why does ethics matters? I guess, why does ethics matter? That's the next bit I'm thinking. It matters because I believe ethics protects participants from harm, because the panel will be looking at whether you can justifiably, you've demonstrate that. So if you have not, they will bring to your attention of things to consider. Ethics matters. We might take it for granted, but ethics matters to build research in our findings. Ethics matters to bring research to our findings, to build trust in our findings, so that we are not manipulating the data or you're doing it harmfully. And also maybe going further, to build trust in the population we are recruiting, because without the participants, you will not have research. If research doesn't have control or sort of a regulatory mechanism and they are harmful, people will be hesitant or will not like to participate in research going forward because of maybe the processes is not clear or things like that. It ensures legal and professional compliance. It ensures legal and professional compliance. Sometimes things can go wrong. sometimes things can go wrong, but if it goes wrong, with ethics in place, there are cases where a litigation can arise, where, and then there will be appropriate framework where this can be resolved. I'm not sure, but if people can remember, there is the case of Pfizer in Kano, of a clinical trial that was conducted. There is a case of clinical trial litigation, Abdullahi versus Pfizer Incorporated, where they were taken to court and things like that. All this, it's just the purpose of ethics also is to make sure to safeguard this and protect this and everything. And a lot of people are against Pfizer in that case. It promotes integrity and transparency. Now, in strictest terms, when you apply for ethics and you say you are going to do X, Y, Z, it is expected that you abide by X, Y, Z in the field of research. If there is any deviation from you doing X, Y, Z, or any challenges, you have to go back to the ethics panel and justify why you are deviating from X, Y, Z, and for them to approve you to continue that. Any deviation from the ethics, it can affect your results and findings and things like that. Now, it's unlikely, but it is possible for your results, or whatever findings you've done, to be withdrawn, or whatever people can write. So when we publish results, especially from the research aspects, if there is an ethical problem or you cannot justify whatever, if anybody can take, if anybody has any query on your big work and everything, they can report the case and everything, and the journal can bring it down if you're not able to abide by those processes and of ethical expectations. Although it rarely happens, but these are things that just to bear in mind. I think that's all I have in terms of ethics. I would like to probably that's all in terms of new information I have for today. But before I wrap up, I want us to talk about the big takeaways. And I would like to come back to you guys, for those especially that are here with us from the morning, but if not, that's fine. I want you to tell me if we can summarize, either put it on the chat box or unmute yourself. From morning till now, what did you learn? Okay, maximum of 3 things. Anybody, please. Can you put it in the chat box? From morning till now, what are you taking away from today's presentation? From morning till now, what are you going to take away from today's presentation? Yes, is it media? Media, Samuel, your hand is up. And whilst you are putting if you have questions also, the platform is open.